In this video, I'll be reviewing the 6-week TMD program. This is a program that we place every patient at the Atlanta TMD Institute on before we realign their lower jaw or their jaw joints. And basically, the purpose of the program is to attack muscle pain. And muscle pain is the most common source of temporomandibular disorder patients' pain. So by doing this particular program, we are reducing the muscle pain, reducing most of the suffering that the patient has, and relaxing the muscles so that we can later move the lower jaw and the temporomandibular joint into its most ideal position so the patient can begin healing. This video is produced by the Atlanta TMD Institute. The purpose of the Institute is to educate dental and medical professionals in TMD. We give courses and to develop knowledge of temporomandibular disorders. We have books, and we will begin doing research in Atlanta, and to successfully treat patients suffering with TMD, patients that have been referred to us almost always from other healthcare professionals who are having difficulty managing the TMD or who do not wish to treat TMD. So we are a resource for other healthcare professionals. I chose way back in 1989 to attack muscle pain and look for ways to support the muscles in order to help them manage joint problems. This particular TMD presentation is designed for patient review and teaches the TMD patients ways to reduce or eliminate the muscle pain associated with TMD. And muscle pain is the number one or the chief complaint of most TMD patients. Muscle pain, however, is only one part of temporomandibular disorders. Looking at this video is not going to cure you. It's going to help you manage the aggravation of the muscle pain. Improving muscle health improves the muscle's ability to manage sick, damaged, painful temporomandibular joints. So we're giving you the ability to manage the problem better and more successfully. Now, the 6-week program, TMD program, does not cure TMD, and a lot of people believe, they watch the video and they're going to be fine, and then they complain. No, this is a program that we put all TMD patients on to prepare them for their real jaw alignment appliance. TMD is a orthopedic problem. In other words, it's putting bones together correctly. And it is not a management problem. Like, you can't take a green pill and get better. It's not like that. The jaw has to be aligned correctly. In 1989, I read a paper that really influenced me a great deal. And it basically stated that muscle pain was the primary aggravating factor, the thing that caused most people to suffer in TMD and most head and neck problems. So I'm thinking, okay, wait a minute then. If I attack the muscles and take care of the muscles, I'm going to be successful, aren't I? Or at least my patients won't suffer so much. So I asked the question, what makes muscles happy? And what makes muscles sad? And Arnold has muscles, doesn't he? So I'm pretty proud of this particular program. I created it in 1989, quite a long time ago. My background is as a biochemist. I was trained as a biochemist. And I'm always thinking, okay, what can I do to make the muscles function better? Let's look at the muscles. Perpetuating is a word that means going on and on and on. So TMD perpetuating factors are vitamin D deficiency, calcium deficiency, magnesium deficiency, vitamin C deficiency, vitamin E deficiency, caffeine, nicotine, lack of exercise, sleep disturbances, and dehydration. So also remember back in '89, if you were recommending like vitamins, you were a witch doctor. And now it's become pretty commonplace. Most physicians test for blood D and recommend D vitamin supplementation. But yet I was doing this a long time ago. And on the top, I have common comorbid conditions later. There, we're not going to be addressing that in this video, but I just at the end of the video, I'm going to be going over. Well, looking at solely muscle function is only looking at one part of TMD. Please do not believe that this is the magic pill. And again, I'm going to say this over and over again. This is a program to help you cope with the pain, decrease the pain, make you feel better, hopefully make you sleep better. So the first thing that's extremely important is to wear your soft muscle relaxation appliance 24/7, except for eating. So take it out for eating. Ideally you'd keep it in all the time because it supports the joint. The joint is no longer crushing into the ear. It's a soft appliance, so that it doesn't really encourage grinding on it as much as a hard appliance might. But wear it 24/7. It's extremely important, and you're doing it for a week. And usually, if you do it successful, you can transition from 24/7 to evening wear. But it's critical to wear it 24/7, and that's a very important factor. Water is vital. You have to have water. Muscles need water to stay hydrated. If you look at dried foods that you take, dehydrated foods that are in camping, little packages and stuff, they are really light because a lot of things have a lot of water in them. And in order for you to function well, you have to have plenty of water. Unfortunately, if you don't drink water, you die. And it's very common that in a short time, 10 to 14 days, with no water, you're going to die. If you just think about it, muscles need water to clean out the toxic waste generated from muscle function, lactic acid and other stuff of it. You need to have plenty of hydration. All of the life-giving biochemical reactions, the reactions that cause you to live in the body and inside muscle tissue, occur in water. Water is the medium that all chemical reactions occur in. So you want to have plenty of water. And when you think about it, really, we are a sack of water, right? We're moving around and there's water inside us. Each and every human is kind of like a movable pond. Humans need water. Babies are basically bathed in their own little pond. They're as though it was in the ocean, except that we're moving around. A baby lives in water, amniotic fluid, for 9 months before the baby's mother breaks water and delivers her newborn. Water is important. God chose to evolve us from the sea. And we have the exact same salt content in our blood as there is in seawater, and that's a 0.9 sodium chloride. And sodium and chloride are minerals that are absolutely necessary. That's another reason why you should never drink distilled deionized water because it will take all the minerals out of you. Always drink regular water. Emergency physicians often give artificial seawater, it's called sodium chloride solution, to strengthen patients in the ER. So what am I trying to say here? Water is life. Without water, there is no life. Water was the basis for life. Very important, extremely important. So the second requirement in the 6-week TMD program is to drink 6 to 8 glasses of water minimum each and every day, get this, of your life, not just during this program. And perhaps more is better, but please, let's hydrate a a good bit. And we know that you're drinking because when you come in, we're going to ask you, you're going to pee. And if you say, no, I don't go to pee very much, we know you're not drinking enough water, right? The water needs to flush you out, right? So take plenty of water, 6 to 8 glasses of water each and every day of your life. It's not just the muscles that are going to benefit, many things in your body will benefit. The next thing we're going to be addressing is nicotine or smoking or dipping. There's just no good reason to smoke, period. It's the number one reason for severe periodontal disease. So we're really concerned about it. It causes lung cancer. It's expensive when you think about it. It's just not a good thing. So first thing we start looking at is smoking. So you don't feel well and you need a boost, so you start smoking, but look at what it does. It causes muscle pain and tremor, shaking, right? Like if you look below, it also causes joint pain. So you got a TMD, temporal mandibular joint problem, and you're smoking and you got joint pain, increased joint pain. But on the top right-hand side, you'll see it causes sleep problems, headaches, and here you are, you're doing something terrible and causing everything to be worse. So let's just throw the cigarettes away. Yeah, there's going to be a problem. You're going to have a problem. People who smoke very often and most often are heavily addicted. Yeah, smoking causes addiction. Sigmund Freud, founder of psychoanalysis and psychiatry, he was an amazing person. Obviously, he was the first person to figure out there's an unconscious, right? Or at least that document unconsciousness. But here you go. He smoked all the time, like cigars. And he died of jaw cancer. And they cut his jaw off, a bunch of his jaw off, and he still was trying to smoke cigars even after they cut most of his jaw away. So again, the third step in this program is to cease taking any cigarettes, nicotine chewing gum, dip, anything. No nicotine while you're on the program, hopefully forever and ever after also. Nicotine is a stimulant, and so isn't caffeine. Caffeine is a stimulant, and we want to relax the muscles, not make them tremble. We want everything nice and relaxed. So if you really look at what caffeine does to your body, yes, it wakes you up. Yes, it is actually wonderful, but it really can create a lot of disaster for people who have TMD. So at least for the 6 weeks that we're relaxing your muscles, we need to get you off of caffeine. And yeah, you'll have withdrawal. Same thing as nicotine. Not as bad, but you will. If you look closely at what caffeine does to your body, it creates headache, insomnia, sleep deprivation. We don't want this. We want you to have a wonderful life. Sleep is the way that you rejuvenate, right? And that you do much better in life. So another thing is trembling. Your muscles tremble and twitch, and we don't want that, right? You put your hands out, they're shaking, and it's just, we don't want it. Ringing in the ears is very common in TMD patients. This is another reason why you need to eliminate this, because many patients do have ringing in the ears. It's very often caused by the lower jaw, the condyle hitting into the ear, but now you've got the caffeine on top of it. You're just really trying to destroy yourself. And again, if you look in the very bottom, caffeine causes dehydration, right? And later, when you resume caffeine drinking, if you want, you should drink 1 cup of water for every cup of caffeine. At least that would be a minimum rule. But remember, for the next 6 weeks, no caffeine. Have you not noticed, people at work or in other places, they're sipping away at the coffee with the right hand and the left hand they're smoking. These people need to wake up, right? So they need to put every stimulant they can into their body, This is abnormal. This is an addiction, please. And please understand it as an addiction and treat it as an addiction. So the fifth step in the 6-week program is to eliminate caffeine completely from your diet. All right, and that includes coffee, dip, no dose tablets, other type of stuff, anything with caffeine in it. And that includes methylxylene like tea and some other stuff. Nothing that is a stimulant. We don't want stimulants. We want the muscles to relax. Linus Pauling was a biochemical researcher, and of course my degree was in biochemistry. I wrote a honors paper on vitamin C and dentistry when I was in undergraduate university studying biochemistry. It took 2 months to research vitamin C and dentistry. And during this time, I continually ran into this gentleman's work. He won, get this on the bottom, 2 Nobel Prizes. So you wake up when someone wins 1 Nobel Prize, that is a huge accomplishment, right? When you win 2, you're an exceptional person beyond belief. And he wrote the book on the right is Vitamin C and the Common Cold, and got an awful lot of crap from physicians, but time has borne out that vitamin C does decrease the common cold. And there's use of it right now in cancer patients, IV mega doses of vitamin C in cancer patients. And you can look on YouTube and see people, singing praises of vitamin C. He also wrote a book, which on the left, which I highly recommend if you want to live. He lived into his mid-90s, and he wrote a book, How to Live Longer and Feel Better. So if you think that my requirement of 6 to 8 glasses of water is a lot, he recommended 1 glass of water every waking hour. I mean, he's a stickler on this, and again, he did live a great deal, many, many years. But vitamin C is essential. So again, I'm using vitamin C to assist TMD patients, and we look at what vitamin C does. There's a lot of stuff, right? You can see all this, but it causes myalgia. That's muscle pain. Myo is muscle, algia is pain. Arthralgia, joint pain. Arthro means joint, algia means pain, bone pain, and post-exercise stiffness. So again, we get back to this, let's stop the muscle pain. Well, myalgia is decreased with plenty of vitamin C, right? So we're going to do everything we can. You also look at post-exercise stiffness. So after you exercise, the muscles are overworked, they're really tight, and you get the vitamin C and they feel better. So this is also a very important thing. But if you look at some of the other stuff that vitamin C deficiency causes, malaise and lethargy, so you don't feel good and you're tired, weakness, loosening of your teeth, gum disease, poor, just a bunch of stuff that vitamin C deficiency does. And it's a very easy thing to take every day. So the best form, I think he recommended this, was Ester C. And Ester C is not acidic. The Ester C, normal C is acidic and burn up your stomach, but Ester C is gentle to your stomach and actually decreases the acidity in your stomach. So Ester C, and I like American Health, that you can get big bottles of this. You can order online, like places like VitaCost, Amazon. You can go to GNC stores or vitamin shops, various places that you can get this. This is the most expensive vitamin that we purchase, but it is worth it because you can take huge doses. I think Linus Pauling, when he was in his 90s, was taking like 12 grams of it. And we've had patients. One particular patient who had AIDS way back in the 80s, and he was taking huge doses of this. His daddy was a physician, and his daddy recommended him to take huge doses, and it worked. So I am a huge believer in Ester C. So the biochemical name for vitamin C is ascorbic acid. Remember, it's an acid, ascorbate. Vitamin C is an acid, and it can irritate your stomach and cause diarrhea. And a lot of cheapy patients go out and they don't look at the bottle and they get regular C, and then they complain a week later, I'm having diarrhea. I can't take this. I'm allergic to it. And I'm just like, no, you're not allergic to the vitamin C. It's an important part of your body. It's the filler, and it's also you got the wrong vitamin C. The acid-free form of vitamin C is Ester C, right? Most people can take lots of Ester C without any stomach irritation. That has been my experience over many, many years. So during the time that you're on the 6-week program, you need to take 2 to 4 grams, that's 4,000 milligrams. Most people come up to me and say, well, Dr. P, the vitamin C is inside my multivitamin. And you look inside the side of the multivitamin and it's only 50 milligrams, 50. We want 4,000. This is a lot more, right? Because and plus, basically, there's no limit on how much vitamin C you can take. It's non-toxic, right? It's non-toxic, unlike the oil-based vitamins. So take 2 to 4 grams of Ester C every day and drink lots of water, right? You've got to drink all this water, drink plenty of water, get them in. They're bigger pills. You can crush them up if you want, but take 2 to 4 grams of Ester C. You should probably do this for the rest of your life. So every single patient, not just TMD patients, should be alerted to this terrible fact. Vitamin D deficiency is a pandemic with more than, get this, half of the world's population currently at risk. Half. Vitamin C is made by the skin, and most people don't go outside anymore. They stay in artificial light areas. But it is a pandemic. And fortunately, some physicians are catching on to this, and they're giving way more vitamin D than I even recommend. And we're finding out that we used to think it was because it's fat soluble, it would stay inside your fat permanently and that would stay in your body. And we're finding out that you need an awful lot to be toxic. And so if you go into a lot of physicians' offices now, my particular physician at the counter is a 50,000 international unit pill that they sell. And they're encouraging vitamin D. Please have your MD take your blood D. Just automatically you should do that. And partly vitamin D and calcium work together. So if you've got osteoporosis, could be eating plenty of calcium, but you don't have enough vitamin D, so you're not absorbing the calcium. Or vice versa, you may take plenty of D, but not enough calcium. So these are very important things. But vitamin, we're thinking about COVID. Well, no, this is worse. This is half of the world. Funny, I did some of the slide presentation back in 19 before the COVID occurred, and I was trying to show how serious this world vitamin D epidemic is, or pandemic. Well, back in 1917, the Spanish flu put out a lot of people, right? There were 50 million people, or 1/3 of the world's population became infected with the virus, and the number of deaths was estimated to be 50 million worldwide. Get this, with 675,000 in the U.S. If you scale that up to today, or 19, that's like 2 million people in the U.S. dying. That's how serious it is. You compare that to COVID, it makes COVID look sissy. Well, basically, this is vitamin D deficiency is huge. So again, the vitamin D epidemic or pandemic is like COVID-19 on steroids. In other words, it is much bigger than COVID, right? And we might say, well, gee, COVID kills. People get into the hospital, but what does vitamin D do over a long period of time? Just look at people that are very deficient. They have lots and lots of problems. And there may be later deaths related to these deficiencies, and we're just not looking at it. So it's extremely important to understand that vitamin D deficiency is something that you must address. So what does vitamin D deficiency do? And again, 50%, you walk around, half of the people you talk to every day have vitamin D deficiency, half of them, all right? It causes chronic pain, muscle twitching. Does that sound familiar? Fatigue and tiredness, bone and back pain, depression, right? They have gut issues. They're getting sick a lot, right? They have bone loss and bone breaking. So this is really important stuff, right? And for I'm selecting this out for TMD patients. This program is for TMD patients, but wait a minute, there's a bigger, greater effect than just TMD. But we're just focusing on D right now for TMD patients to relieve TMD muscle pain. So step 7 in the 6-week TMD program is take 4,000 international units of vitamin D every day. Now, one, you might consider going into your physician to have your vitamin D blood levels drawn because you can get a lot more than this to compensate and get up to speed much more quickly. I'm just recommending a pretty safe everyday level. That level is going up nowadays, and we do it in IUs. We don't do milligrams. So IUs, learn to read the bottles. But consult your physician also, but you can right off the bat start taking 4,000 IUs of vitamin D every single day. So the next vitamin that you need to take, and I think this tops up the vitamins for muscles, is vitamin E. So vitamin E causes neuromuscular problems, nerves and muscle problems, neurological nerve problems, dysarthria, bad joints, absence of deep tendon reflexes. You don't move your body around very well. And get this, loss of the ability to detect where your body parts are in three-dimensional space. And one of the things we find with TMD patients is they can't find their bite, right? I can't find my bite. They bite down and they can't find it. They can't repeat it. And that's something, right? Because you need to know where your bite is so that you can chew food. But vitamin E deficiency is an important thing to address in TMD as far as muscles go. So the 8th recommendation or requirement of the 6-week TMD program is to take 1,000 international units, IUs, of vitamin E each day. Now, a lot of people talk about aloe. Well, the active ingredient of aloe is what? Vitamin E. So vitamin E makes you soft and subtle, and it makes everything flow nicely too, but it helps muscles. It plasticizes the muscles, makes them nice and soft. Calcium is extremely important along with D. Calcium is one of the primary components along with magnesium of your bones. So it is really important to have plenty of calcium in the diet. The problem is most people are allergic to dairy, but calcium is the most abundant mineral element in the body. It has 2 key roles. A very small proportion of body calcium plays a very vital part in regulating critical functions, including nerve impulses, right? How your nerves tell your body what to do. Muscle contraction, there we go. Muscles, right? Muscles. That's why we're doing the 6-week program. And the activities of enzymes. More than 90%, 99% is located in the bones, where it plays an important role in their structure and strength. And most people don't know, but your body dissolves and reforms your skeleton over about 7 years. So the skeleton that you have today was not the skeleton 7 years ago, because it's constantly Pac-Manning through the bone and releasing calcium and then making new bone to dependent on your particular activity level and what you're doing. So you're reforming all the time. So calcium deficiency, it's pretty widespread. That's why, all elderly women, they're in their late 70s, they fall, they break their hip, and half of them die within like 6 months to a year. wait a minute, we need to stop that. And the way we stop it, plenty of calcium in the diet, right, with D, with food, and then exercise. And we'll talk about exercise later. But what does calcium deficiency do related to TMD? Well, it causes muscle cramps, difficulty swallowing, tingling fingers, and numbness. Also causes lethargy, mental confusion, a whole bunches of stuff. And you need to be aware of this. A lot of teenage young ladies, when they go on calcium for a month or so, some of their premenstrual cramps go away. Not all the time, but very commonly. And it's like, wait a minute, that means that the cramping muscles were due to a calcium deficiency in their cases. Again, we're talking about pandemics. This is way back when. This is 2004, right? U.S. Surgeon General warned that by 2020, which is last year, 50% of the people over age 50 will be at risk for osteoporotic fractures. And we can stop that. We can prevent that. And part of that is having plenty of calcium in the diet, and plenty of that is D, and plenty of that is exercise. And we'll talk about that. So there is calcium and magnesium in bone, right? And magnesium is a mineral that is extremely important. And what is so super neat is that we have a pill that has both calcium and magnesium together. And a kicker is there's zinc in it too, which helps with immunity. So magnesium deficiency causes muscle cramps for real. And migraines have been tied into magnesium deficiency. Generalized weaknesses, abnormal heart rhythms, epileptic seizures, increased insulin resistance or diabetes. So these are things that have to do with magnesium deficiency. And I think in general, our bones are suffering. And if you think about how animals ate years ago, they would take a prey, they would kill an animal, they'd eat the guts, and then they'd very often go after the bones. The bones would be dessert. And they'd chew on the bones and get their calcium and magnesium plus the marrow, which is really good. So we don't do that anymore, right? You don't see people on the street taking down a deer. And we have to be thinking, we have to get these minerals in our body so that our bones can be healthy and that our muscles can be healthy, because we need calcium and magnesium for good muscle health. You see what muscle cramps occur. One of the amazing things that I've already mentioned that is we sometimes see girls that have terrible, debilitating premenstrual cramps that they go away with the calcium magnesium supplementation. But magnesium needs to also be included in the minerals that you take every day, and thank God it's all together. Having zinc in the calcium, magnesium, zinc pill is just a huge bonus. I think they sell zinc lozenges to help people with their colds, right? So what does a zinc deficiency do? It weakens your immune system. If you want to fight COVID, you want to fight the common cold, right? You want to fight upper respiratory infections, zinc is important. Zinc deficiency also is implicated in depression, and I think there in TMD patients have a lot of depression, and there's like 6 to 8 reasons why you can have depression. And it doesn't have to be that you're crazy, and it doesn't mean that you have to take antidepressives. It could just mean simply you don't exercise, or you have many other types of deficiencies. A lot of just the minerals and vitamins that we were talking about. Vitamin D deficiency causes depression. So wait a minute, let's look at depression, right? Because it may not be psychological. It very often is not psychological. But again, zinc deficiency causes increased allergies because your respiratory system is not functioning well. Perhaps that is one of the reasons that modern man has so much nasal congestion, nasal obstruction, nasal allergies. You can't concentrate, and it's important for wound healing. People that have zinc deficiencies also can often have diarrhea or be susceptible to diarrhea. So there's just zinc is just a bonus in the calcium, magnesium, and zinc pill that you're taking with meals. So step 9 in the Atlanta TMD Institute's 6-week program is take one tablet of calcium, magnesium, and zinc. I call it a horse pill. It's a big white pill with each meal. So you got to eat it when a lot of people will, and I know this because I've had patients that literally poop out the white pill, and they poop it and they say, well, this doesn't work. Goes right through me, doc. I'm like, yeah, well, do you eat it with food? No, I took all 3 at once. That's not what you do. You take one tablet, each particular meal, 3 meals a day, and you will start absorbing that. You only absorb a little bit, but if you do it 3 times a day, you're absorbing more and more. And this is what we're doing by doing it at each meal. And this is 6 weeks. So things will change later, but I'm trying to get you up to par. Probably exercise, lack of exercise is the number one problem that I see, not just in TMD patients, but generally in the world itself. And Plato, who's really the father of philosophy, he was Socrates' pupil, and he said, lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it, right? You want a good condition? Exercise. That's what he's saying. The next person below is Hippocrates, the father of medicine. And he said, eating alone will not keep a man well. So if you have this incredibly wonderful, natural, organic diet and you think that you're going to be fine, well, that's not what Hippocrates said. He said, eating alone will not keep a man well. He must also take exercise. For food and exercise work together to produce health. And just recently, a book written by a psychiatrist, John Ratty, MD, Spark, basically goes over the fact that, well, 1 hour exercise each day is equivalent to a dose of Elavil. So this goes back to what Hippocrates and Plato were saying. So let's look at exercise, at least some exercise. What is really amazing is that muscles make a protein, muscles make brain-derived neurotropic factor when they're exercised. Listen, man, you got to listen to what I'm saying. So BDNF is Miracle Grow for your brain. So, you put Miracle Grow onto plants and they grow crazy, right? Well, look at this. If you want your brain to grow and not shrink like in Alzheimer's or dementia, you need exercise. And there are clear facts that basically exercise will prevent brain problems later. Maybe not avoid them completely, but certainly decrease their incidence. So please, exercise. It's extremely important for your body. And this is Dr. Ratty. It comes from his book that I had recommended, Spark. So get this, aerobic exercise has been shown to be as effective as antidepressants. So why don't your physicians prescribe this? I don't know. Your patients will walk in depressed on antidepressants, and I will be upset. I will be very upset because the physicians never even bothered to even discuss exercise as a potential therapy. And there are other benefits too, maybe perhaps preventing dementia. So women who exercise lower their chances of developing dementia, get this, by 50%. If you're a woman, I would consider exercising. Exercise sparks new brain cell growth. We talked about BDNF. And the evidence is incontrovertible. You cannot challenge it. Aerobic exercise physically transforms our brains for peak performance. You want to be able to think well at your job. You want to be able to be on your toes, enjoy life, experience life. You've got to exercise. It's very important. And you've got to weave in exercise into your daily activity. Take a walk for a half hour at lunch, right? Rather than sitting and eating. Eat something, take your calcium pills, and take a walk. So you have better exercise tolerance when you do it. You have lower body weight, lower blood pressure, better control of blood sugar and cholesterol, lower cardiovascular morbidity. Less chance you're going to die if you exercise. Lower stroke risk. Wait a minute. Diminished accident rates, which means that your body's functioning better. It's not going to slip over, fall, and you're going to be alert while you're driving. Better social acceptability. You have strengthened bones in postmenopausal women who break their bones and die. Significantly reduced cancer types. Wait a minute. Right? Better respiratory reserve. You can really breathe better. Lesser incidence of viral infections. You want to avoid COVID? Exercise. Take D. And this lower risk of depression. Again, depression keeps on popping up as one of the things that is associated with TMD, very often for reasons that are not psychological, which this is a very important thing to me. Improve sleep. You want to heal, you want to sleep, exercise. And people who exercise live longer. Let's do this. I personally like, swift walking. You walk and increase your pace and slow down if you wish so, and then increase your pace. I walk an hour every morning. Uh, I need to up. I go to the gym in the evenings to do weight work. I think everybody should, including women, particularly women who break bones. You want to double your bone mass, your bone density. Exercise, even 1 pound weights over 6 months to a year will double your bone density without taking any stupid pills. And while you're walking, look at the green trees. They're beautiful. Look at the blue sky. Watch the squirrels run around. And in the evening, gaze at the stars. Because what? There's other things in life. You are so fixated, so closed in on your thoughts that you're dealing with your life, and your life is not that important. You're going to die, and 200 years from now, no one's going to know that you were ever here. Why are you so worried? We have a blessed environment, plenty of food. Good, you don't see people dying of terrible things. There are no Vikings running in and killing people. We have plenty of food, very nice environments, houses. Everybody has a place, running water, refrigeration. Everything's wonderful. What is there to worry about? You'll soon learn that nothing is really serious unless you personally make it serious. You got to exercise. So the recommendation is to exercise at least 1 hour every single day. You can split it up. I like walking a good bit. I don't like treadmills because it's repetitive injury syndrome, same motion, same joints, same muscles, same way every time. When you're walking around, you're using different muscles depending on the level of the ground. But certainly a treadmill is better than not doing anything. But you can do a half hour one part of the day, a half hour in another part of the day. Well, however you wish to split it up, it's okay. But it should be something that slightly increases your heart rate and switches up your body a little bit, right? So exercise 1 hour every day. I personally like walking, but you can bike, do stationary bike, you can do treadmill. Uh, this it doesn't include heavy weightlifting. This is more aerobic based. Doesn't have to be running, but you could jog if you want. This is up to you. But I want you to get your heart rate up slightly and get your body moving around. Sleep is incredibly important in life. It's interesting. Why would God make someone inactive, eyes closed, just laying there for 8 hours where a predator or a tiger could just come and eat you? There must be something incredibly important about it's 8 hours of rejuvenation that's needed to have humans grow. And we know that during sleep, especially in REM, we are consolidating all our knowledge for that day, storing it, and having everything also recuperate during that period of time. Sleep is absolutely necessary. We secrete growth hormone, which repairs the body during sleep, particularly in the early part of the evening. It's incredibly, incredibly important, and we're starting to understand that. Dentistry is coming to the forefront with obstructive sleep apnea, and there's just a lot to be talked about related to this. As far as TMD goes, the first thing we want to do is just some really basic stuff. We just basic what we call sleep hygiene stuff, and we'll talk about it. And we're just going to start with going to bed at the same time and waking up at the same time and teaching your body to be in bed and only being in bed for sleep, not for reading, and just trying to adapt the body to a sleeping environment. So sleep disturbances cause tension type headache, which is the most common headache in the world. There's no question about that. The International Headache Society said that tension type headache, which is muscular headache, is the most common headache in the world. So if you don't get sleep, you get tension type headache. You have fatigue, depression, lack of concentration, attention deficit. So the kid with attention deficit disorder may have sleep apnea or sleep disturbances. So we want you to sleep. It's very, very important. It's going to help your diabetes. You're going to lose weight. You're going to be able to remember things better. You're going to have more energy. You're going to have less headaches. You're not going to be depressed. You'll be able to concentrate. These are things that are extremely, extremely important. So we want to start just by getting to bed on time. We do have a handout on sleep hygiene, all the various things that you can do to improve your sleep. But for this program's purpose, we're just going to get you to bed at the same time, and you need at least 8 hours of sleep. So the 11th item in the Atlanta TMD 6-week program is sleep 8 hours or more. And you say, well, Doc, I can't sleep 8 hours. But we're teaching the body to develop a habit. So, I personally go to bed at 10 every evening, right? I'm trying even sometimes to get to bed a little earlier, even at 9, because I think sleep is that important. And then I wake up at 6. I have an alarm that goes off at 6. Some people say you shouldn't do that. Well, I like to train my body. Sit Fido, wake up Fido. And so I'm teaching it to go to bed, giving it a rhythm, a daily rhythm that it can follow. So sleep 8 hours or more. Go to bed at the same time each and every evening. Wake up at the same time each and every morning. These are just some basic sleep hygiene things, very basic, and we're going to start with that. So I think it's very important to understand the concept of training your body to obey your commands. That's a simple first step in developing good sleep. I'm not saying that this is the only thing, but it's the first step. So you have to train your body to obey your commands, right? I think it's important to remember the soul is not the body, or however you wish to look at this. The mind is not the body. Your soul must order your body to stay in bed and sleep. So go to bed. Say, well, I can't sleep. I said, but go to bed and stay in bed at the same time. No discussions in bed. Keep the lights completely off. Don't read in bed. Don't watch TV in bed. Bed is for sleep. Teach the body that bed is for sleep. And that is just the very first step in achieving good sleep. Step 1. Unfortunately, people like to throw rocks, right? People like to stone, and have that statement that he that with no sin can throw the first stone. But wait a minute here. there are a lot of people that complain and complain and complain, and there's no magic, purple pill that you take and go down the rabbit hole and you're better. It's not. Human beings are complex. And Hickham's dictum is a statement that medical residents often learn. It was developed by John B. Hickam, and he said, a patient can have as many problems as they damn well please. So to think that you have one problem, oh, well, it's my sleep. Oh, well, it's the way I eat. Oh, it's my exercise. Oh, well, it's because of my fibromyalgia. Oh, well, no. You can have lots of problems, and we, in order to address these problems, we address them one at a time, and we peel the onion, and it's very important. So to be highly critical is to be unfair, because we're just doing the first thing. We're addressing muscle pain, and there are many other things that people have that have TMD that need to be peeled. And this is not simplistic. You can't say, well, I'm going to do this, I'm going to be healed. It's not going to happen. You probably have many things that are going on. And that's what we're going to do. We are going to unpeel everything with you later on as we examine your particular TMD case, all the signs and symptoms that you have, and we'll address them. But the TMD 6-week program is the starting point. So TMD has many other things that tend to all converge or affect the patient at the same time. And we are taking care one at a time usually. But I'm just listing some of the things that we see, So some common comorbid means with death, with together. The problem is right? Together. Conditions. Hypothyroidism, particularly what some people call hypothyroidism type 2, which is like insulin resistance, thyroid hormone resistance. So you have normal tests, but you're definitely hypothyroid. The mitral valve prolapse, connective tissue disorders, nasal-respiratory allergies, nasal allergies, food allergies, nasal obstruction, mouth breathing. I think sleep is coming right to the forefront right now, obstructive sleep apnea, but there's more to sleep apnea, not just obstructive sleep apnea, but hypopnea. Hypo means low. In other words, you're not having complete periods of 10 seconds of complete non-breathing. You might have lower ones, like 6 seconds of non-breathing, which may not kill you, but it'll make you totally miserable. Abnormal habitual postural stress, computers that you're turning your head to one side, the other, sitting incorrectly, psychological stress, which is a precipitator, parafunction like bruxing or grinding, which there's a reason for that, physical stress, including repetitive adverse loading, and motor dysfunctions. And we're seeing more and more people coming in with their mouths or necks moving continually, shaking, and I don't know if I'm just looking for it more or seeing it more, but I am experiencing more and more TMD patients coming in whose hands shake. Thank you so much for taking the time to watch this video. Watch it again. And it's designed to be the first step in treating your TMD and helping you heal your body and your mind. The important thing is these things work for life. So very often when you're completed with your therapy, you may have issues in life. Everyone does. We're not perfect. You can go back on this 6-week program at any time in your life and to help you cope with any things that are going on. We don't make you 16 years old again. I like to always tell people that we're healing you to the best we can given the situation that your body presents to us. But we're not making you 16 years old again. There'll be crises in life always, and they have to be managed, and you have to be able to do that. But again, thank you for joining our family of patients, watching the video. I hope you enjoyed it, and I hope that you'll consider perhaps even subscribing and perhaps getting updates on various stuff. This is a patient video. We also have doctor videos. And if you're really up to it and you're a patient, you might want to look at some of the doctor videos. We've tried to make them as simple as possible so that they can be understood completely. So you might enjoy taking a look at some of our other videos.